So I promise we're gonna make this check-in process simple, easy, and relaxing. Okay. So basically, as your nurse today, my job is to ask you a series of questions. Yeah, a series of questions, and I'm going to document the answers to your questions here, okay? And then this information will be used by your dentist and oral surgeon to best decide what care you need, okay? Okay, perfect. So I promise this will be just relaxing, just like we're having a chat, except for it's all about your medical history. Alright, so we're gonna start off with the basics. Can I have your first name, please? Okay, perfect. So I'm just gonna write it down. So, okay, perfect. And your last name as well, please. Perfect. Okay. And then I know what the date is today, so I'll fill that in. I need your email address, one that is still valid, that you still use. Okay, so okay. Perfect. And can I have your phone number, please? Perfect. Is that your mobile phone or is that a home phone number? Mobile, okay. Mobile, perfect. Okay. And now I'd like to have your address, please. Okay, so. Perfect. Perfect, okay. Do you take any medications on a daily basis? So that could be everything from like birth control or pain medications, medications for any medical conditions that you may have, heart medications, autoimmune medications. Okay, so a couple. Okay, so can you tell me the name of each medication and then how many times you take it per day? So if you take it twice a day, once a day. So, okay, that's twice a day. Okay. In the morning and in the evening. Okay, perfect. And then you take once a day. Perfect. And then you sometimes take, okay. If it's only sometimes, I'll put a star next to it to be like it's only as you need it. BRN. Okay, perfect. Do you have any allergies that we need to know about? Allergies? No, so you don't know. Okay. Perfect. Okay, is there a chance that you could be pregnant or are looking to become pregnant in the near future? Okay. Yeah, that's an important one for us to know, especially if you're gonna have surgery. Alrighty, and these are kind of a couple questions just about your day-to-day use of substances, just so we have a better understanding of your general lifestyle, okay? So, in the last week or month, how much would you say you have consumed alcohol? So, never, occasionally, monthly, weekly, daily, or more than 4 times a day. Okay, perfect. And for smoking tobacco or cannabis products, same thing. Never, occasionally, 1 per day, 1 pack a day, or 2 packs a day. Okay, perfect. And I know this sounds like a little interrogation style, but it's just for us to know. I'm not here to judge you. Do you use any illicit drugs? So anything that's illegal. I'm not going to report you or anything. It's just for us to know in case you need anesthetic. Okay, perfect. And for your daily exercise level, would you say that you never exercise, occasionally exercise once a week, 2 to 3 times a week, or every single day? Okay, perfect. Great, okay. So that's kind of like the basics of what we need to know about you. And now we are going to go into some of your dental specific health history, okay? Fantastic. Okay, so I'm going to ask you a series of yes or no questions, and I just need you to answer it the best that you can. Okay. So, yes or no, you have pain in your teeth. Pain in your teeth. No, okay, perfect. Have you ever had any tooth sensitivity? Okay. Are your teeth sensitive to heat? So if you eat something hot, like drink a cup of tea or bite into something warm, does it hurt? No, okay, perfect. How about sensitivity to cold? So if you have a bite of ice cream or if you try to bite into a popsicle, does it hurt? Yeah, I know that one really gets me for sure. Do you have a tooth sensitivity to sour foods? So if you were to eat like a lemon or have a really sour candy, does that hurt your teeth? Okay. I know that's kind of a funny one. You think it hurt your tongue more than your teeth, but it can hurt your teeth too. And do you have a tooth sensitivity to sweetness? So if you have a really sweet candy or a dessert, do you find that your teeth hurt? Okay, perfect. Have you ever had bleeding from your gums? So after you're brushing your teeth or after you floss, do you find that your gums bleed? Yeah, okay, that's really common. And how about bleeding in your gums after flossing? Yeah, okay, perfect. Do you have sensitive gums? So if you were to touch or like if you kind of snag your toothbrush on your gums, does that hurt? Okay. And are your gums swollen? Like if you look at them, do they look puffy or feel puffy with your tongue? No, okay, perfect. Do you have any headaches? I know that doesn't seem like it's related to your mouth, but it turns out it can be. No, okay. How about earaches? Same thing, close to your jaw. No, okay. Have you ever had any aching in your jaw, so along the bottom of your jaw, on the other side as well, like aching when you're chewing or aching from talking too much? Okay. Have you ever had a tired jaw, so it feels like, oh gosh, I don't know if I can talk or bite as much as I want to, it feels tired? Okay. How about a clicking jaw? So when you open your mouth, do you feel like you can hear or like feel a clicking at the joint in the back of your jaw? Okay. Have you ever had your jaw get stuck? So this is common for people who overextend or over open their mouth. They go, and you can actually dislodge the joint. So it's a ball and socket joint. Let me see if I can. It's like a ball and socket joint. So if you overextend, you can pop this out, and that can actually cause your mouth to get stuck open. Yeah, I know, kind of scary. Have you ever had that happen? No, okay, perfect. Trust me, you don't want that to happen. Have you ever had the sensation where you're unable to fully open your mouth? So you're trying to, but you can only go. No, okay, good. That's not very funny there. Have you ever noticed that you clench your jaw? So when you're like biting and tending, putting tension and stress on your jaw muscles. It's very common for people to do when they're stressed, as well as when they're sleeping, actually. Yeah. Oh, okay. What about grinding your teeth? So, doing that. Do you notice yourself doing that? Some people do it subconsciously without even noticing. Some people do it while they're thinking or stressed again. Okay. Do you find that food catches on your teeth or gets stuck in your gum pockets? So if you're eating a sandwich, do you find that you get food stuck in the back of your teeth or stuck in places that's hard to get out? Okay. Have you ever had tongue pain? Tongue pain. So, pain of your tongue. Okay, perfect. And how about tongue swelling? That can be quite an intense feeling where your tongue feels like it's 2 times too big for your mouth. No? Okay, perfect. Okay, so this is just going to move into the last section that I have here. So this is your dental history. Dental history. So this is going to be me asking you questions about what has happened previously from dental professionals, okay? Great. So when you've had dental examinations in the past, have you noticed that you gag easily? Yes or no? No? Okay, good. Perfect. Do you find that dental work makes you nervous? Okay, no, that's good. That's very fair. It's very normal to feel nervous about the dentist. On average, how many times would you say you brush your teeth per day? Okay, perfect. How many times you say you floss your teeth per day? Okay. And how many times would you say you use mouthwash per day? Okay. Do you chew gum regularly? Yes, no? Okay. Do you chew tobacco at all? And if so, is it regularly? Okay. Have you ever or regularly smoked from a pipe, tobacco, or other products? Okay. How often are you using pain relievers? Okay. Have you ever or do you regularly take muscle relaxant medications? Okay. Have you ever had trauma to the head? So a concussion or hitting your head on something hard? Okay. Have you ever had trauma to your face? Okay. How about trauma to the ear? No, okay. How about trauma to the mouth? So, have you ever had like someone punch you in the mouth, violent, or just any cuts, scrapes, bruises, pain there? Okay. And trauma to the throat. To the throat, to the throat, to the throat. Okay. Do you regularly take fluoride supplements? Okay, sounds good. These are kind of some more personal questions. Are you satisfied or dissatisfied with your current smile? Okay, perfect. Do you wear dentures? Okay. Do you have braces or have had braces in the past? Okay, perfect. Are you happy with the color of your teeth? Okay. And are you interested in full spectrum dental care or just the occasional cleaning? Okay, perfect. Okay, I think that's mostly it. I'm just going to ask you a couple more questions about your medical history. Have you ever had surgery before? For anything, doesn't have to be just for your face or for your head. Yeah, okay. So what would you say the surgeries were? And can you give me a rough timeline of when they happened? Okay, so we have that. Okay. And how old were you? Oh, you were a baby. Okay, so a little while ago. And then any other ones? Yep, okay. Perfect. And how long ago was that? A couple years ago. Okay. And then when you had those surgeries, do you know if you had a general anesthetic or if you had sedation? Not sure. Okay. Well, I'll try to explain them and you see if that helps. So, if you have had a sedation, that means that they needed to put an IV in your arm. And then they did not intubate you. So you were breathing for yourself, even though you were kind of happily floating through and don't remember the procedure at all. Whereas on the other hand, for more hardcore or invasive procedures, you'll have the same medication to make you sleepy, but they'll give you more of it so you're fully asleep, and then you'll be intubated, which means a tube will be put from either your nose or your mouth into your breathing airway, and you'll be connected to a machine that will be breathing for you during the procedure. So a general anesthetic is very common for like large abdomen surgeries. It's common for people who have big orthopedic reconstructive surgeries, spinal surgery, some gynecological surgeries, things like that. Okay, so just based on the 2 surgeries you've had, I think you've had 1 full general anesthetic just for that one. I don't think that'd be possible to do under sedation. Okay, perfect. Do you remember having any reactions to the anesthetic? Like when you woke up, were you drowsier than the average person, really nauseous, very stressed, anything like that? Okay. And you didn't have any reactions to the medication in any way that they mentioned that you should keep an eye on? Okay, so I think that is everything on my form. See, that wasn't too bad, right? Yeah. Do you have any questions for me about anything before the dentist comes in? No? Okay. Well, I'm gonna go put this into your chart. If you think of any other information that you think I or the dentist should know, let me know and I can add it. And the dentist will come in shortly and do a checkup, okay? in, not too stressful. And we'll see you next